Hi everyone, my name is Tiffany Zhang and I'm the founder and host of Empathy Gaps, an online YouTube video podcast. Welcome to episode 10! Harris County is one of the most populous counties in the nation, as well as one of the most diverse. As someone who lives in Harris County and is passionate about mental health, I was curious about the pre-existing support systems put into place for mental health in the county. Thus leading me to reach out to Dr. Lee as the Chief Medical Officer of the Harris Center for Mental Health and IDD. In this episode, Dr. Lee and I will discuss AI in the field of psychiatry, changes in mental health before and after COVID, and dismantling healthcare disparities. Here is my conversation with her. Hi everyone, and welcome to Empathy Gaps, an online video podcast focused on creating a safe space to discuss mental health and psychology, while also working to address the needs of the current mental health crisis. I'm Tiffany Zhang, your host, and today we have a very special guest, Dr. Lee. Dr. Lee is the Chief Medical Officer of the Harris Center for Mental Health and IDD, and she also has faculty positions at Yale, Baylor, and UT Health Houston. Dr. Lee, thank you so much for being here today and taking the time to join me. Before we start, is there anything else that you want to add regarding to what you do and who you are?
No, I think you covered it, Tiffany. Thanks so much.
No problem. So, from that introduction, I guess the viewers kind of know that you're the Chief Medical Officer of the Harris Center, which entails leading a team of psychiatrists to ensure that the Harris Center reaches its full potential. So, as a leader of more than 100 psychiatrists, what does your day-to-day look like? And I guess, how do you effectively lead your team?
Yeah, absolutely. That's a great question, actually. And for me, my day to day can look different depending on the week, but some of the core components depend on different ongoing processes we have. So I participate in a number of different administrative leadership meetings, which include patient care reviews, so clinical case reviews, where we review patient care and whether or not we thought it was appropriate, whether we think there could have been any opportunities for improvement. We have a number of different clinical quality meetings, including our pharmacy and therapeutics meetings, our quality meetings directly. So we have a system safety and quality and experience committee. We also have a number of different clinical care processes where I participate and engage in either giving guidance or leadership related to those topics. In addition, one of my favorite parts of my work is doing patient care directly. So I spend time directly serving our clients here in Harris County and getting a chance to do initial psychiatric visits as well as being able to follow up with their care over time. And so I love that about my job. I also really love medical education. So I engage with our resident psychiatry community psychiatry program, as well as provide learning opportunities for them through a roundtable. We also have a CME series that I help host and co-lead within the center so that our clinicians can elevate their knowledge through the offering. And so we have a number of different things going on in my area, and that's just my area that I have direct responsibility for. We also have stakeholder engagement meetings where we connect with partners and others within our center. At the Harris Center, we use an interdisciplinary team approach, which means that we have collaborative relationships with our social workers, with our nurses, with our administrative team members. And so in order to make the care go as smoothly as possible, we take time to connect with them to think through, hey, like what are leadership decisions we need to do in order to work through this situation or this case scenario came up? What are things that we need to address, both from a policies, procedures, as well as a process improvement perspective. So lots of different administrative areas focus, a fair bit of it focused on clinical administrative, and then some directly in clinical care. So, those are some of the things that I get to do. And, I also spend some time engaging with the public. So that's what we're doing today. And so I get a chance to meet with students. I get a chance to connect with community partners and engaging with them to talk about how we can improve and bridge mental health services here in Harris County. And so that's a little bit of a start to share about what I do, but happy to answer some more questions if you have those.
Yeah, that sounds like such a busy yet fulfilling schedule. And I know you talked about like connecting with patients and whatnot as part of what you do as part of your work at the Harris Center. But what does that like personalization process for treatment of mental disorders at the Harris Center look like?
Yeah, absolutely. So at the Harris Center, we're considered what's called the local mental health authority and a local IDD authority, which means that we actually have a model of care that is developed for all local mental health authorities across the state of Texas, managed by the Texas Health and Human Services Commission. And so as a result, when you enter into the Harris Center, you go through an eligibility process. And then once you get entered into care, when you first see a psychiatrist, what goes on is that we actually do what's called a diagnostic psychiatric evaluation. Prior to this, you might meet with one of our clinicians who will go through some screening questions as well as questions for you about psychiatric symptoms and provide some recommendations. And so that process is really to be able to identify who qualifies for what levels of care. And so some individuals might want therapy alone, and those are the services that they like to participate in. Some individuals might want therapy and medications, and others might just want to get connected to a doctor to be able to do their medication management. And so once that process takes place, when we as physicians take a look at your care, we will really do that full diagnostic interview, which means that we ask about your symptoms, we evaluate what are some of the pressing needs. So when I do this, I will ask patients, hey, like, what is the single most important thing for you to get addressed today? And it can be anywhere from, I really have a hard time sleeping. I just am not able to get sleep, or they might have difficulty with concentrating, or some of the more classic psychiatric symptoms, including anxiety and depression when doing different things in their daily activities. And so, once we have a full picture of what's going on with their mental health, we're able to identify what diagnosis they might have. And that might range based on what is reported by the individual. And then we work to come up with a treatment plan and work with the clinician that initially evaluated them or the team that they're assigned to so that we can provide a whole centered, patient centered way of care. And so that's the goal. And, from my lens, for some people, medications are easier and they enjoy doing that because it's sort of something that they can use easily and it's accessible. Others love therapy, others like a combination of both. And so, depending on your specific circumstance, we really work with you to identify your customized, individualized needs in order to best serve your mental health and hopefully help you toward improvement and feeling better.
Mhm. That sounds really great. And I know like you must have like a lot of experience being a psychiatrist and just like diagnosing people. Based on your personal experiences, what kind of like changes in mental health have you seen in like what changes in mental health have you seen before and after COVID?
Yeah, that's a really good question. I think there's a number of different things that have happened with COVID, right? As a global pandemic, it really forced and sort of encouraged people to work from home, do school from home, really try to keep away from one another. And as a result of that, it sort of increased the disconnectedness that we might feel in society, and that might happen with challenges with just not seeing people in person, and then also with sort of not being able to connect as regularly and isolation and loneliness. And so with the pandemic, there were also the individuals that had COVID. And we know now that there's actually some psychiatric components of that, including long COVID, as well as psychiatric risk factors that are as a result of it. And we also know that individuals that experienced the pandemic experienced it in different ways. There have been individuals that passed away from COVID within families. And so there are so many different kinds of mental health impacts depending on how it impacted you and your family and your community. But what we do know is the trends are that there were significant increases in mental health outreach. So there's been a lot more individuals seeking care and being prescribed medications. So just a paper that came out last week in pediatrics identified a high number of overall increases in antidepressant use following the pandemic. And what they also found is that this was especially high in adolescent girls compared to adolescent boys. And so, we have seen that perhaps in girls in the adolescent age group, this has actually impacted them more. And we also do see there being much more media attention to mental health. So we've seen more individuals seeking help and receiving it, which is a great thing. And I think we're receiving it through different means, both telehealth as well as in-person care. And so I think that the demand for mental health services has gone up. We've also seen that for individuals that might have stayed home and didn't continue their treatment, they got worse. And so we've also seen some more acuity, which means that individuals are coming in with higher symptom profiles compared to those that would have maybe stayed in care, that weren't forced into trying to isolate away from society. And so that's another trend that we've seen both nationally as well as locally.
Hmm. And do you think the increase in, I guess my question is like, do you think the increase in people seeking mental health services is a result of just like increased sadness and anxiety, or do you think it's more just like a cultural change where people are more willing to just have mental health support?
I think it could be a combination of both, right? If there's greater awareness of, hey, this is what you can do to seek mental health services. If you're feeling this way, please go see a mental health professional. Then I think that can sort of perpetuate or sort of encourage folks to reach out to get those services. I think it's been wonderful to see the Gen Z group really embrace and be encouraged to get help early. That is probably happening concurrently with, just a real increase in the need for mental health too, right? And so it probably overlaps to some degree, and it is really difficult to separate them out because they didn't and like occur independently, or they happened alongside one another. And so I think those two different exposure points can, cause sort of there to be a trend of increased interest and also, increased demand.
Hmm. Yeah, I definitely believe it's a factor of both things. And going off of that, like before COVID, have there, like I know there was a spike in increase for mental health support, but have those numbers kind of like receded after like the world opened up, or have they like kept on growing or stayed consistent or?
Yeah, those are some of the things we're following now. So a lot of folks have worked during and beyond the pandemic on tracking things like outcomes. So one of the worst outcomes that can happen in behavioral health services delivery is tracking the rate of suicide. So folks are tracking outcomes like suicide, the rate of death related to overdoses, as well as access numbers. Are there more people accessing mental health services, and in what way? So insurance carriers will track the number of times somebody has reached out for care. That prescription study is really tracking data around how many prescriptions were ordered and filled. And so you can actually do studies to look at all of that. Some of it is out there and some of it is not yet. And so some of what I would look at for the outcomes and the longer term impacts of COVID on mental health really might be us reflecting on that data in 5 years or so, because the public health emergency just ended in May of 2023. And so, COVID is still happening. So it could be happening at a less intense rate, partially because we have vaccines, and also the spikes and the numbers in COVID hasn't been as high as in the early years of the, early year of the pandemic, the first year. And so we will want to track some of those outcomes over time.
Hmm. Yeah, definitely. And speaking of kind of like change and like long-term effect, how has AI changed the field of psychiatry? Like, is there anything we should be conscious about when thinking about AI in the field of psychiatry?
Yeah, there's a lot of discussion about AI right now. And so there's a number of different people pursuing both, different products that incorporate AI in therapy or in service delivery. I think that it's still such an early time to think about, hey, like, what are the impacts? How is it used? I'm part of a national professional society called the American Psychiatric Association, where I am on the Council for Quality. And so it's a topic that we discuss, and are monitoring, because the use of technology has rapidly increased, and younger generations really want to use, AI and different tools. They've used it in education, they've used it in many other settings. And so, is it going to really apply to healthcare, and how, right? And so, there's different strategies to think about that, right? Whether it's really, collecting a lot of data to then disseminate, and identify some really important types of trend, different trends, whether it's tools directly in clinical practice. There's many, many ways of using AI. I think I've been involved in some of the discussions around the ethics behind it, and how do you apply that? And are there some biases in the learning algorithms that can really disproportionately impact how we model, and use those tools? And so it is so early to really tell where that's headed. And so, we'll see. But I do think that, one of the things that can comfort me is really, hey, like, there's lots of thoughtful people wanting to really engage time and energy around how to be thoughtful about the application of AI tools. I do think in some settings it's already here, and then in other settings, folks are still learning about what tools to embed in the clinical spaces. And so, more to come on that one, Tiffany.
Yeah. I was just curious about this because I actually had an interview with someone else, and she's like the reviewer at Headstream Accelerator, which is like this program where like entrepreneurs pitch their products that help support people's mental health. And she said that in the latest round of applicants, there has been like a trend of incorporating AI into these products that support people's mental health. So I was just interested to see how AI would be able to enhance the field of mental health and psychiatry.
Yeah, and there are so many different kinds of tools out there. I mean, where I think AI can make a significant contribution once we're able to work through some confidentiality, pieces, is um, really helping clinicians document in a more thoughtful way, so that they're not, the clinical team members aren't spending their time documenting for every 45 minutes of clinical patient time. If you document for another 45 minutes or 30 minutes, well, that's time that you could be spending, to really support additional patient care. And so, could AI really serve as an efficiency tool to encourage, the ability for individuals to do less of the stuff they don't want to do, and more of the things that they do? Now, the nuance in that is, well, where does that information go? Is it safe and secure? People find talking about their mental health really challenging to start out with. So then if it sort of goes into a machine learning algorithm that can give folks a lot of anxiety when they might be coming to get seen for anxiety to start out with. And so, just thinking through sort of some of the structural ways in which we are thoughtful about the incorporation of AI will be critical.
Yeah, and I feel like if AI were to be a huge part of mental health services, I feel like has to be an effort in destigmatizing the use of AI in mental health if it were to become a huge part in the field of psychiatry.
Well, I mean, mental health services have been an area where there's a lot of stigma to start out with, right? And
Mhm.
so it's really about navigating well for what and how is this beneficial to people, right? And so I think as with introduction of technology and innovation in general, there's going to be the early adopters, the folks that are going to be the laggards, and then there's going to be folks that just never come along, right? And so I think adoption of innovation can be challenging, but it's also really important as we think about ways in which it's connecting to our day-to-day experiences. I mean, machine learning is being used in all kinds of different ways. And, I think that there's probably some good in that. We just have to be thoughtful about how to get there.
Mhm. And then I know you talked about the stigma kind of attached to mental health services already, but how can ordinary people support loved ones with mental health disorders?
Yeah, I think there's a number of different ways. I think for individuals that want to learn a little bit more about mental health and how to navigate, mental health challenges in loved ones, there's a course called Mental Health First Aid. The Harris Center actually offers public courses related to mental health first aid, and the goal is to be able to allow lay people to understand what are the concepts and the challenges. It's like a first aid class and, the physical health side, right? This is how you might respond to something else, right? And if you observe some of the symptoms of somebody potentially having more and more challenges, either in the social domain or just having a hard time functioning, then, how do you help them, right? And so this course can give an early entryway to being able to help people have the language to use to start to understand what to do in that circumstance. Now, there are a number of different more advanced trainings, and for those that want to get deeper involved, you can actually take additional courses and get exposure. But when in need, when you're noticing someone going into crisis, something that is really important to know, and we're publicizing it more and more, is that recently there's a new phone number out there to be able to call for help. So instead of just saying, okay, there's 911 for medical needs, or hey, like I need somebody here, a police officer, for mental health crises, it's 988. So you can actually just dial that number, and there will be somebody that can locally respond to you. And at the Harris Center, we actually provide the staff members for the crisis responses. And so in Harris County, it would be one of our staff members that reaches out both on the phone as well as potentially are the folks that are going out to the community to respond to behavioral health crises. So, learning more, try mental health first aid. If you are seeing something that's closer to an emergency, call 988.
Hmm. Yeah, I'm really glad that the Harris Center is doing so many things to support ordinary people that do want to help their loved ones. I think especially that's important because I feel like not everyone has the money or means to go out and get a diagnosis or go to therapy, which I mean it's like sad. So I'm glad that Harris Center is doing things to help support ordinary people that want to help others. And can you talk a little bit about access in healthcare and I guess like the racial disparity and how we can eliminate that?
Yeah, sure. So one of the things that's really beneficial about the Harris Center is we actually are the provider of choice for individuals that are uninsured or may not know that they have access to mental health services. And so we don't turn anyone away. And so at our center, in any of our outpatient clinics, you can just walk in to be able to get evaluated and be able to just get your care there. And so that's very unique and different because a lot of times, in another clinic, they might say, hey, like, what's your insurance status? And, can you prove that you have the financial means to be able to pay for this appointment? Or we might not see you. But that's not the case at the Harris Center. We actually are paid through state dollars as well as different other grant mechanisms and county funding to be able to help individuals that really don't have means in other ways so that we can get you the mental health care that you need and be able to perform that and deliver that with high quality. So the types of services we want to deliver aren't just like, oh, somebody who is unable to pay for services is getting worse care. We really want to excel and give better or the same or just amazing care for the people that we serve. And so we're delighted to do that. And by doing that, we actually have a really diverse set of community members that reach out for our services and can continue with us for many, many years. And so, just so you're aware, it can be really helpful to have these sets of services in the community and provide this community good.
Hmm. Yeah, and also when I was doing research, I really liked how Harris County also provided support for the homeless people because I feel like that's a population that's usually largely overlooked. So yeah,
Yeah.
I'm glad that Harris County is doing so much to support mental health, and I hope that maybe someday like all mental health centers will be able to do the same.
Yeah, absolutely. Thank you.
So yeah, thank you so much for coming on, and yeah, I will see everyone next time. Bye.